Welcome President of Children's Health Defense, Mary Holland.
Thank you so much. It is truly an honor to be here with these mama and papa bears. There is no stronger force in the universe than parents for their children. So we're kindred spirits. I'm president of Children's Health Defense, and we were a group of moms with vaccine-injured children that really created this organization. And we were very fortunate back in 2016 that the current Secretary of Health and Human Services, Robert F. Kennedy Jr., founded Children's Health Defense. So the organization was founded to end the epidemic of chronic childhood disease. Over 50% of our children today, way over 50%, have some kind of serious chronic condition, be it severe allergies, asthma, ADHD, autism, diabetes, bipolar, dyspraxia, anxiety, obesity, you name it. These are terms that we didn't even have in our vocabulary, OCD, 50 years ago, and yet they are incredibly prevalent. Over 70% of young people could not qualify for the military if they wanted to because of their physical and mental health. There's something wrong. As John Solomon was saying earlier today, the abnormal has become normal. It is not normal. It is not normal to have so many sick kids. And it's our job as the moms and dads and the adults to turn this around. So Children's Health Defense works through 4 different pillars. We have education, advocacy, science, and litigation. And we believe we are not a medical organization per se. We're not going to tell you what to do medically, but like you, we believe in the truth, and we believe in liberty, and we believe that parents armed with the truth and liberty will make the right choices for their individual children. So we as an organization oppose all medical mandates. As I think the Surgeon General, Joe Ladapo of Florida, told you yesterday, I don't know if he said it yesterday, but he said it in the press conference with the governor not long ago, any medical mandate drips with disdain and slavery. And that is the reality. It is literally the state, whether it's the local, state, or federal government, telling you, we control your children, we control your body, you don't own your body, you don't own your children, the state does. And that is a form of slavery. What we have when it comes to medical mandates is medical tyranny, and we who stand for liberty must oppose medical tyranny. So, although we stand to end medical mandates, and the states of Florida and Idaho are at the front of the curve, and we are so grateful for them setting the pace, in other states in the country, in the majority of states, 45 states, we have religious exemptions, and parents can assert religious free exercise rights to say, no, my kid is not going to get a vaccine. Because we do believe that the science shows, the meta-analyses that we have show, that unvaccinated children are by far and away healthier than vaccinated children. They don't have the same chronic health conditions. So sadly, in 5 states today, we do not have religious exemptions. In California, New York, Maine, Connecticut, and West Virginia, we do not even have religious exemptions. And that is catastrophic for those families that do not want to vaccinate their children at all. And other states, blue states, unfortunately, Hawaii, Massachusetts, and others are at risk of losing religious exemptions. So I'm going to come back to what our legislative fix is on that. But I want to tell you about a case that we funded in New York State very recently, just to show you how important this is. We represented through counsel a 16-year-old girl, Sarah Doe, who lives on Long Island. And Sarah, in 2019, when New York State, in its wisdom, repealed the religious exemption, this girl wanted to stay in school like any normal kid. And so her family, regretfully, decided to catch her up on the vaccines she had not yet received. And she developed several life-threatening autoimmune disorders. And she then was told that in order to stay in school, she needed a third dose of a hepatitis B vaccine, which is a disease that is contracted through sexual contact and through IV drug use. And the irony is that under federal law, if you have hepatitis B, you can go to school and be in the workplace. But without her third dose, her school district was prohibiting her from coming to school. And her school district was overriding her medical exemptions. And she had 7 of them from different doctors. And we had to take that case to court in order to have a federal judge tell the school district, you have to admit this child with 7 medical exemptions. She deserves her place in school. And the judge ruled that way. But it's to show you that medical exemptions have been perverted according to the incentives of the medical system, and religious exemptions have been denied in these 5 states. So I want to encourage you. I know Moms for Liberty are incredible activists at the grassroots, incredible legislative agent. There are 3 bills in Congress right now that I would commend to you if you care about medical liberty and health liberty. One is the GRACE Act, introduced by Representative Stubbe of Florida, asking that every state must have a religious exemption. It's part of free exercise, it's the First Amendment. Let's get our legislators to support it's called the GRACE Act, and as a former speaker said, grace is so important. It's the GRACE Act. The second one is from Representative Gosar of Arizona. That is end the vaccine carve-out. Basically, in today's world, the doctors and the vaccine manufacturers have no liability, and the states can compel vaccines. When you have compulsion and no liability, let me assure you, you do not have safety and effectiveness, as they say. So this bill is called End the Vaccine Carve-Out. We need to restore some level of liability for the doctors and for the vaccine manufacturers so that actually they are made safe if people are going to take them. So end the vaccine carve-out. And the last but not least is a bill by Tom Massey of Kentucky, repeal the PrEP Act. The 2005 Public Readiness and Emergency Preparedness Act is what made COVID possible, what led to the creation of your powerful, wonderful organization. Basically, we would not have had the emergency use authorizations tests or the masks or the gene therapies without that PrEP Act. So Tom Massey has a very important bill, repeal the PrEP Act. So bottom line is, you as parents, as moms and dads, need to be the ones to make decisions for your children. Only you can fully, truthfully act in the best interests of your children. We are completely aligned on that. Through our education, we have an online newspaper that's free, The Defender. We have online streaming every day. And as I said, we do science and litigation. And our conference is coming up in Austin, Texas, beginning of November 7th to 9th, Moment of Truth. I know you stand for truth. We stand together. Thank you very much.